The human papillomavirus causes premalignant and malignant lesions of the cervix, vagina, vulva, anus, penis, and oropharynx, as well as genital warts. The recent development of prophylactic vaccines directed against the most prevalent disease causing HPV types has helped to prevent disease related to HPV.
The human papillomavirus causes genital warts, cervical cancers, and other anogenital cancers. The quadrivalent human papillomavirus vaccine is recommended for girls and women 9 to 26 years of age to reduce the incidence of human papillomavirus infections. But information on the safety of HPV vaccines in pregnant women is limited. Although HPV vaccination is not recommended during pregnancy, some women may be inadvertently vaccinated in cases of unplanned or unrecognized pregnancies. A nationwide, register-based cohort study of 581,550 records of pregnancies in Denmark between 2006 and 2013 investigated the association between quadrivalent HPV vaccination during pregnancy and adverse pregnancy outcomes, including major birth defects, low birth weight, small size for gestational age, spontaneous abortion, preterm birth, and stillbirth. A propensity score adjusted matched analysis of vaccinated and unvaccinated women found that quadrivalent HPV vaccination was not associated with a significantly increased risk of major birth defects, with a prevalence odds ratio of 1.19 and a 95% confidence interval of 0.90 to 1.58. Similarly, quadrivalent HPV vaccination was not associated with a significantly increased risk of spontaneous abortion, stillbirth, preterm birth, low birth weight, or small size for gestational age. The authors conclude from this large nationwide study of pregnant women that there was no significantly increased risk of adverse pregnancy or birth outcomes associated with HPV vaccination during pregnancy. Full study results are available at nejm.org.
In clinical trials, the bivalent HPV virus-like particle vaccine against HPV type 16 and 18 was efficacious against related infection with these types and against cervical dysplasia. 12 and the quadrivalent HPV virus-like particle vaccine against type 6, 11, 16, and 18 was efficacious against related infection against cervical, vaginal, vulvar, and the anal dysplasia, and against condyloma related to HPV 6 and 2. Advantage: it is considered a preventable and curable sexually transmitted disease if treated promptly, but not all infected once necessarily develop cancer in the uterus. HPV as such does not appear as cause morbidity in official hospital records. Disadvantage: in women is deadliest type of cancer because of human papillomavirus increase in young people.
When Barbara Archiello's doctor recommended a vaccine to prevent cancer of the cervix, she jumped at the chance.
I just think it's a great thing for women to have.
But the most comprehensive look at side effects since the HPV vaccine was approved in 2006 raises questions about its safety. In today's Journal of the American Medical Association, the CDC reported over 12,000 side effects after 23 million doses were distributed. 94% of the problems were not serious, but 6% were, including patients who were hospitalized, permanently disabled, or died. There were 32 deaths, one in over 700,000 doses.
It really isn't increased above what we've seen with other vaccines in that age group and what is seen generally in people of that age group.
But problems that did occur more frequently than expected were fainting, about once every 12,000 doses, and blood clots, once every 500,000 doses.
The reporting on blood clots was concerning to CDC, concerning in the way that we think it needs further investigation.
One less. Gardasil.
Critics question the vaccine makers' aggressive ad campaign because it paid medical societies to help spread the word and underplay the importance of evaluating the vaccine's risks and benefits.
It screeched its message. All women are at equal risks. Protect yourself from cervical cancer, and this is the way to do it. And the fact that the medical societies repeated this message is what the issue is that concerns us.
Merck says after reviewing the new report of adverse events, it continues to be confident in the safety of the vaccine. While the CDC and FDA continue to recommend its use, doctors say they'll look at the HPV vaccine for girls and women on a case-by-case basis.
If you're going to administer the vaccine, you should discuss these risks with your patient.
Something else to consider for parents uncertain about whether to have their daughters vaccinated. Routine pap smears can also help prevent cervical cancer. Maggie.
A great reminder. Dr. John LaPook. Thanks, John.
Issue applied in Ecuador. Studies indicate that 50% of the population that is sexually active is carrier of HPV in Ecuador, papillomavirus responsible for 10% of cancer cases in women. According to the OMS, most cases are not diagnosed since it is an asymptomatic sexually transmitted disease of only male infections such as vaginal warts, which does not allow an accurate diagnosis. Conclusion. The 9B HPV vaccine prevents infection and disease related to HPV 31, 33, 45, 52, and 58 in a susceptible population and generate an antibody response to HPV 6, 11, 16, and 18 that was not inferior to that generated by the HPV vaccine. The 9B HPV vaccine did not prevent infection and disease related to HPV types.
Hi, I'm Dr. Elaine Low from Dr. Tan and Partners. Today, I'll be talking about Gardasil 9 and pap smear. In Singapore, cervical cancer is the third leading cause of cancer deaths in women aged 15 to 44 years old. Smoking, having multiple sexual partners, and human papillomavirus infection increase the risk of cervical cancer. Human papillomavirus, or HPV, can affect anyone who is sexually active. This includes both men and women. Most people infected with HPV show no signs or symptoms, meaning they can transmit the HPV virus to others unknowingly through any kind of sexual activity or skin-to-skin contact. HPV is classified into low risk or high risk. Low-risk HPV can cause genital warts in both female and males. These are flesh-colored growths on the genitals and they are infectious. High-risk HPV increases the risk of cancer in the cervix, vulva, and vagina for women as well as in the anus for men. The good news is cervical cancer can be prevented through vaccination. Gardasil 9 is a vaccine that helps protect against human papillomavirus. It provides protection against 9 major strains of HPV, which include HPV types 6, 11, 16, 18, 31, 33, 45, 52, and 58. That can cause up to 90% of genital warts and cervical cancers. The vaccine, however, does not treat the infection. It can be given to both females and males from the age of 9 to 26 years old. For those aged 9 to 14, 2 doses 6 months apart is recommended, while those aged 15 to 26 years, 3 doses will be administered according to a schedule at 0, 2 and 6 months. After the completion of HPV vaccination, all females who are sexually active and above the age of 25 should still undergo routine cervical cancer screening via a pap smear every 2 to 3 years. A pap smear is a simple procedure that can be done in clinic to obtain some tissues from the neck of your womb. This is to look for early abnormal cell changes in the lining of the cervix before they become precancers or cancer. Thank you for watching. I'm Dr. Elaine Low from Dr. Tan and Partners. For more information about Gardasil 9 and pap smear, please visit our website